Hi everyone, my name is Kim and I'm a dental hygienist and a health and wellness blogger. I like to refer to our profession as preventative care specialists because we now know so much of the oral microbiome is related to our overall health and well-being. That's why I'd like to talk about Alzheimer's and the latest developments in our field and how we may be able to decrease our patients' risks of developing this disease. September marks Alzheimer's Awareness Month, so I wanted to highlight the importance of identifying factors we can talk about with our patients. I'm sure most of you can think of a number of people in your personal and your professional life that have dealt with this heartbreaking disease. I know I personally have experienced it with multiple family members and patients. As clinicians, we have a number of ways to start this conversation with our patients. The first conversation can start immediately, yet gently, with caretakers and family members of our patients with Alzheimer's and their risks associated with this disease. We now know P. gingivalis is a really bad bacteria, and it can lead to all sorts of systemic health issues. Now studies show it's possible that it can lead to the release of amyloid beta cells that are commonly found in Alzheimer's disease. Toxic enzymes known as gingipanes are secreted and have been shown to mediate toxicity in a variety of our cells. They have been correlated with the pathology of proteins related to our normal neural function. This discovery and research is huge for our profession. We need to start talking with our patients, especially of mid-age, to take action and decrease their risk of developing disease. The studies are finding patients in this age range are most susceptible to Alzheimer's due to undiagnosed blood pressure and, you guessed it, untreated gum disease. These are two major things we should be talking about daily. One of the first things that we should be doing chairside is taking blood pressure before we even start treatment. This will immediately open up opportunity for conversation if they have a high reading. The second thing we do is assess gingival health before performing any kind of prophy. If inflammation is present, then we need to address it by altering home care, more frequent cleanings, or deeper cleanings. It is also important to note, as our profession progresses in identifying systemic health issues, that sleep apnea, vessel health, and oral candida have all been directly correlated and connected to the development of Alzheimer's as well. I'll end on a simple yet positive note that while this disease is complex and so is the research, it is very important to educate ourselves and also as clinicians to realize that we have such an empowering role and we are now able to save lives with our profession. I hope that you can take away something that you've learned today and share it with at least one person, whether it's a patient, a colleague, or a family member. And please, I encourage you to continue your research in the oral systemic health of yourselves and your patients so that we can continue to better our profession and continue saving lives. Thank you.